All right, everybody, did you know that especially now in February, we're spending a lot of attention on women's heart disease? Did you know that 43 million American women are affected with heart disease? We're going to talk about this morning on why you should be talking about heart disease with your OBGYN. And this morning we have with us Dr. Nina Strollo, who is here at Suburban Women's Healthcare. Dr. Strollo, nice to see you.
Nice to see you, Linda. How are you today?
Fine, thank you. And it is important for your OBGYN to talk about heart disease with their patients.
Absolutely. You know, when women come to us, we are a primary advocate for women's care in general. So when you come to your OBGYN, you're mostly focused on getting your mammogram, getting your pap smear. However, 1 in 3 American women die from heart disease every year. So we want to focus on their health in a comprehensive way.
Is it always about someone's weight that gives you an indicator that they may have heart disease?
Well, that's certainly one of the big factors that we focus in on, but we also are looking at their blood pressure. We're talking about their family history. Do they have high cholesterol diagnosed by their primary care physician? These kind of things are things that we like to hone in on and then be, like I said, an advocate for their health care in general.
Now, what about the women who are looking to get pregnant? Can they have a healthy pregnancy and have heart disease?
You know, it is one of the contributors to a high-risk pregnancy, but we certainly don't want women to stray away from getting pregnant if they have heart disease. We are focused on their blood pressure every time they come in for their pregnancy, but we will send them to specialists, and we want them to know that while they can still get pregnant, we will help them have a very healthy, safe pregnancy as well.
And for the women on the other side of the coin, can they utilize forms of birth control if they have heart disease?
100%. Now, there's certain birth controls that we want women to stray away from, but here at Suburban Women's Healthcare, we do offer all kinds of birth controls, progesterone-only birth controls, non-hormonal birth controls, and different options for tubal ligations as well.
Okay, now what about women with a hormone replacement? They're looking at that at this point in their lives. I would imagine they would be at a higher risk for heart disease.
You are absolutely correct. When it comes to hormone replacement therapy, it is a very controversial topic. You know, basically the bottom line is any woman that's going to start on hormone replacement therapy or is already on it should be aware of their heart health, and we should be utilizing those hormone replacement therapies in the smallest amount of dosage for the shortest amount of time. But it's something that we will review with them and make sure that their whole health is taken care of here at Suburban Women's Health.
So what we're learning in February is that heart disease is not just a man's disease. Women can present with this very differently, but it's important that they talk to their doctor about this.
100%. It is actually the #1 cause of death in women in America. So we have to actually put that at the forefront of what we're thinking about when it comes to healthcare.
This makes an awful lot of sense. You should come and see Dr. Nina Strollo. She's here at Suburban Women's Healthcare right on Sheridan Drive. Remember, February is Heart Month, ladies. Don't forget to talk to your OBGYN about heart disease.